We know that chronic pain can be complex and that it has a huge impact on people's lives. To gain a better understanding of chronic pain, let's take a look at a typical patient journey through the medical system. Like all journeys, pain has a starting point. This could be due to an accident or injury, or because we have done something out of the ordinary and put stresses and strains on our bodies that we are not used to. At first, we may try to deal with it on our own. We might use over-the-counter medication or take things easy for a bit in the hope that it'll settle down. If that doesn't work, we may think about getting some help. In most instances, this will involve visiting our GP. Our expectation is that they will ask questions and examine us, and this will tell them what the problem is and allow them to make a diagnosis. They will then be able to decide what treatment is necessary. Our hope is that the treatment will lead to a cure or, at least, make things a lot better. But what happens when the treatment does not lead to a cure? Well, we go back to our doctor, who may decide to send us to someone else, a consultant or specialist. Once again, we are assessed, but this time we may have further investigations, like scans or blood tests. Hopefully, this will confirm the original diagnosis or lead to a different diagnosis. As a result, our treatment may stay the same, or a new treatment may be suggested. Once again, the hope is that this will improve things. Unfortunately, when it comes to chronic pain, patients often tell us that this is not always the case, and a cure can remain elusive. So what happens next? Well, we go back to our doctor or specialist, and the journey continues. A lot of chronic pain patients describe going around and around in circles for months, or even years. However, we now have an added problem. As well as being in pain, we also feel frustrated, angry, confused, anxious, and in a lot of cases, we may start feeling that we are not being believed. So, if we are going to stop patients going around and around in circles, we need to see if there is a better way of managing chronic pain.